Along with us, it is 9 minutes after 8 o'clock, 8:09. We're going to jump in a little early here because I want to start talking with Dr. Polsky. Good morning, sir. How are you?
Good morning. We are just doing fine over at the health department. How are the two of you today?
We are pretty good, sir. Pretty good. So every week we ask and we hope, and I don't know, is there any good news that you have to share with us today?
Well, there's nice spring weather out there.
That is true.
Yeah, okay, we'll go with that.
That is true. Hey, I wanted to make mention of this because I know Calvert County government, they decided to put out a thing yesterday kind of clarifying what the health department had put out. I thought the advice that you had given yesterday on the calverthealth.org website was perfect, but it's a classic case of people not really reading and seeing what is being said, and then they get on social media and it blows up. I thought the advice that you gave was actually a good idea with going to stores, because let me tell you, people are not social distancing in stores. They're just not.
Thank you that you thought that was helpful advice. What we're really trying to do is encourage people to just think about what they're doing a little bit more. And it's not lost on any of us that people are cooped up. They get antsy. They want to get out, and there are very few options for them. Getting back to the nice weather, I'll just throw out there that people do have the opportunity to go outside and enjoy a bit of nature right now, and don't necessarily have to go to any of the grocery stores or the few places that are still open. But yeah, the suggestion was, and it was emphasized, this would be a strictly voluntary thing.
It says right in the thing, it says this is for your health and family members and the safety of those in the community. They ask that you voluntarily limit trips to the grocery every 5 days. That is so reasonable.
I would hope so. And although you're right, you're always going to have people who I think seem to go out of their way to look for things to get angry about on social media.
Oh, yeah.
But for the 80, 90+% of people who want to find ways to help their community members, keep their families safe, that maybe just for them to pause and think, maybe I can condense my shopping down, that I can just go once or at most twice a week. So we laid out, taking a look at by the first letter of your last name, different ways that people could just make it simple for themselves. But they don't have to follow that. The main thing is that people just don't end up going to the store every 1, 2, 3 days. And I know the governor just came out yesterday with an order for people to start wearing face masks in grocery stores, in other retail locations, which I think is a fine idea. But we need to keep in mind that face masks are not a cure-all. They're not a substitute for basics.
Right.
And I would hope that people really think about the people working in those grocery stores and convenience stores, most of them making not much more than minimum wage. And that, if nothing else, to limit the potential that those people will end up getting exposed to the virus.
Right. And there are new rules that the Calvert County Health Department for employers of the box stores and things like that. I mean, like wiping down all the carts. You have to have some type of like a Perel or a sheet or some type of sanitation sheet available to the employees and the people who come in. Is that right?
Correct. So it's important also to keep in mind that face masks don't prevent transmission through your hands. So if somebody touches something, the next person uses the same cart. So the idea that there would be some reasonable way of disinfecting carts that people are using in stores.
So, okay, Dr. Polsky, I know you guys are hesitant to make any kind of predictions, and I'm not trying to put you on the spot, but have you heard anything positive about? I mean, where are they with like a vaccine? Is there something that we can look forward to 6, 8, 10 months down the road that maybe there'll be something we can get to actually protect us from this?
Trials have started for vaccines, and how quickly they'll go, there's no way to really predict. But the experts in this are saying that it's probably about a year away. Maybe we get lucky and closer to start of flu season next year, something's available. but in all likelihood, we're looking at about a year from now. In the meantime, what we're really hoping is that we have a ramp up in testing ability, which still, it's hard to believe that we're sitting here in the middle of April and we're still telling people that unfortunately we can't test them when they become symptomatic unless they have severe enough illness or they're a first responder, they meet certain categories. And people are still getting turned away from tests.
Okay, I got to ask you a question because I know that Dr. Fauci mentioned it, I think it was last week, and if we disagree on this, that's fine. I will still respect you as a doctor and everything, but apparently Germany and Dr. Fauci and people in the CDC, they're talking about immunization certification. What are your feelings on immunization certification?
I'm not quite I haven't heard that term before.
Yeah. Well, it's a weird one.
Does it mean that someone shows that they are immune because they've been infected with the virus?
Right.
Yes, you can work and go into stores and do stuff.
You would be tested, and if the antibodies show up in your system that you've been exposed and got over it, so on and so forth, that you would be issued some kind of little certificate that says, hey, don't worry about me, I'm good to go. And, I don't know. Has there ever been a bad idea coming out of Germany when it comes to labeling of groups?
Right.
Has that ever gone off the rails? I don't know.
At the moment, there is only one antibody test or one test to show that you've been infected with the virus. And right now, there are very, very few labs in the country that can run that test. So as of April 16th, it's not a feasible option.
Mm-hmm.
But hopefully into May or June, I think one of the real key applications for that are particularly for healthcare workers and first responders, that if we see that they have a good level of immunity, it makes it much safer to decide who will be staffing in the emergency room or the intensive care unit. That also helps to decrease the need for as much personal protective equipment. One of the questions is going to be how closely does that the immunity test correspond to people being able to get reinfected, and that's something that there's good reason to think that those tests will have a good correlation in that regard, but that's something that until enough people get tested, that we won't know with certainty.
Okay, let me ask you this, because I've heard this a lot, that somebody has coronavirus, they recover from it, and then they test positive for it again a few weeks down the road. Can you get a coronavirus strain, because apparently there's like 3 strains or something, I don't know, and then get another strain? Or is this the same coronavirus?
Wouldn't you be immune to it?
That just hasn't left your body yet? I mean, what's the story there?
So let's break that apart into things.
Sure.
One is, can you get a different strain of coronavirus? And the answer to that is yes. That there are 4 strains that we know cause the quote-unquote common cold, and so those, almost everyone's had a cold at some point. That certainly has not protected people from this strain of coronavirus, and conversely, getting this strain of coronavirus doesn't protect you from the common cold.
Right.
So the other question, which I think is even more important, is when people get tested for, let's just call it COVID-19 to take ambiguity out of it.
Yep.
That what that test is looking for are strands of RNA. So we have DNA as our genetic code. This virus has RNA, doesn't have DNA.
Oh.
And all it does is it tests to see if there is RNA in your respiratory tract. So we know that for some people, the actual virus particles are gone. They're no longer infected. They cannot transmit infection, but they can still harbor remnants of RNA for some, at this point, undetermined period of time. So you can have people who, quote-unquote, test positive again, but it does not mean that they actually have active infection.
But let's just take someone we know. Let's say Tom Hanks. Could he get coronavirus or COVID-19? Could he get this again?
I can't give a definitive, but we can say from lots of other infections that as long as he has a well-functioning immune system, it would be extremely, extremely unlikely. So if somebody is going through chemotherapy or some kind of immune suppressant, then all bets are off for them as far as any sustained immunity.
Right.
But for the average reasonably healthy person that we can say from lots of other viruses that we've been dealing with for decades and decades, that it would be very, very unlikely, at least within the first several years, that they would be susceptible to being reinfected.
Okay. Good. Well, that's something. Hey, there's the good news.
That's the good news.
We found the good news.
Awesome. Fantastic. Now, I do want to say, though, what you guys have on your website at thecalverthealth.org, which is a great website. It's a wealth of knowledge for people who want to know about COVID-19 and how to protect yourself and businesses and things like that. It's a great resource. But I just want to say again, I think what you guys have asked the citizens of Calvert County, and other counties can be included, to do, I think it's a great idea. The only problem is you have to get everybody to do it. Like last name A through C, shop on dates that end in a 0 or a 5. That's perfect. So then you have less people in the store, but then you got to get the H's through L's to follow. You know what I mean? Which is so hard to get everybody to follow in line step. You know what I mean?
Right. And I think the best way to have people cooperate is not to force things down people's throat. Mm-hmm. But I think we need to continue to emphasize that we are in this, and not to get too cliche, but we are in this together. Mm-hmm. That not only for our physical health, but for our emotional well-being and for our financial well-being. Businesses are not going to reopen as long as there is a substantial amount of new infections going on. So the more that we can cooperate as a community to decrease the spread of infection, the faster people are going to get back to work, and the sooner that people are going to really just be able to resume their lives. And so I think that is the level that you need to appeal. It's not your rights or not your rights. It's that there is a reality of what's going on right now. And there is one path as a society that we've chosen, has been chosen for us, however you want to put it, mm-hmm. with governor's orders and other restrictions. We need to do the best we can within those constraints to decrease infections and, again, collectively get back to what we would like to see for our lives.
All right.
Right. Until next week, Dr. Polsky. Until next Thursday. Can't wait to talk to you again, and hopefully maybe a decrease in active cases, new active cases. That I'm knocking on wood, and I'm hoping that's what is happening. But for our listeners out there, if you want more information, calverthealth.org for the Calvert Health Department. A great resource, a lot of great information. And Dr. Polsky, again, we thank you for your time, sir, this morning.
Well, thank you both. And just a quick last bit that, as we talked about in previous weeks,
sure.
People who are struggling with their mental health, with substance use issues, and particularly if there are any issues with domestic violence, we have phone numbers on our website that people can contact 7 days a week. We have a 24/7 hotline that can help people with any of their needs.
Thank you, Dr. Polsky. I appreciate that, and we'll talk to you next week.
All right, take care.
All right, you too.
Bye-bye.
Bye. I like what he said about, with this great weather, go out. We walked last night.
We took a walk last night.
The boy, you and I, and we walked, and I got to be honest with you, I felt better after we got home. I did. I felt good. I was like, okay, a cold air, cold breeze,
yeah.
and
plus you also get that, for me anyway, I mean, let me preface this by saying the guilt I feel of not working out almost never outweighs my desire to sit and watch whatever I'm watching.
Right.
But you do remove that guilt, if that makes any sense, where you can go,
sure.
Hey, I did something today. I took a walk.
Right. And it was, and you waved to neighbors, and we walked with neighbors.
And you can look down your nose at all those couch potatoes that didn't walk. Good God, why don't you do something with your life?
There are not enough miles we could walk to make up for the couch potato-ness that infects our system,
right.
Okay?
All right. Well, listen, still some questions that remain unanswered as it relates to this virus. Mm-hmm. I think his projections of a year for a vaccine are too long. I don't.
Coming out of the Brits are talking October.
Well,
they just started human testing this week on this one vaccine, so I don't know. I hope.
I hope there's people out there like me. Let me be the first to raise my hand. That would say, maybe we don't. Let's cut some corners. I mean, I don't know what all the testing you have to go through.
Sure,
I know,
sure.
I know
A lot.
It's very, very rigorous. And I would say maybe at this one, if you're like 90% sure it works, maybe we go with it. All right, listen, it's 8:24. Let's see what's happening with the weather.